Welcome to Anatomy of Life, where medical science becomes easy to understand. Explore the organs, systems, and conditions that shape your health. Learn how your body works, what can go wrong, and how to protect it. Anatomy of Life, bringing the human body to life. Enlarged prostate, benign prostatic hyperplasia, BPH. Have you ever wondered why many men begin to experience frequent urination, especially at night as they get older? Or why some men feel a constant urge to urinate but struggle to fully empty their bladder? The cause is often an enlarged prostate, a very common condition that affects millions of men worldwide. The prostate is a small gland, but when it grows larger than normal, it can significantly affect a man's quality of life. This condition is called benign prostatic hyperplasia, or BPH. Benign means non-cancerous. Hyperplasia means enlargement caused by an increase in cell number. Although it is not cancer, an enlarged prostate can cause uncomfortable urinary symptoms, sleep disruption, and serious complications if left untreated. In this video, we will explore what the prostate is and what it does, why the prostate becomes enlarged, the symptoms and warning signs, how it affects the urinary system, how doctors diagnose it, treatment options, and ways to manage and protect prostate health. By the end of this video, you will have a complete understanding of this very important condition. What is the prostate? The prostate is a small gland that is part of the male reproductive system. It is located just below the bladder and surrounds the urethra, the tube that carries urine out of the body. In young men, the prostate is about the size of a walnut. Its primary function is to produce a fluid that mixes with sperm to form semen. This fluid helps nourish sperm, protect sperm, improve sperm movement. This makes the prostate essential for reproduction. Because the urethra passes directly through the prostate, any change in prostate size can affect urine flow. Think of the urethra like a straw, and the prostate like a ring around the straw. If the ring becomes larger and tighter, it squeezes the straw, making it harder for fluid to pass through. This is exactly what happens when the prostate enlarges. What is an enlarged prostate? An enlarged prostate occurs when prostate cells begin to multiply, causing the gland to grow bigger. This growth is gradual and usually happens over many years. As the prostate enlarges, it presses against the urethra and partially blocks urine flow. This creates resistance, making it harder for urine to leave the bladder. The bladder must work harder to push urine through the narrowed urethra. Over time, this extra effort can weaken the bladder muscles. This leads to many of the symptoms associated with enlarged prostate. It is important to understand that enlarged prostate is extremely common. By age 50, about half of men have some prostate enlargement. By age 80, up to 90% of men are affected. This makes it one of the most common aging-related conditions in men. Why does the prostate enlarge? The exact cause of prostate enlargement is not completely understood, but hormones play a major role. As men age, hormonal balance changes. Testosterone levels gradually decrease. At the same time, another hormone called dihydrotestosterone, or DHT, continues to affect prostate cells. DHT stimulates prostate growth. Over time, this causes prostate cells to multiply, leading to enlargement. Age is the biggest risk factor. Other risk factors include family history, obesity, lack of physical activity, diabetes, heart disease. These conditions can affect hormone balance and inflammation, contributing to prostate growth. It is important to note that prostate enlargement is a natural part of aging for many men. However, the severity of symptoms varies. Some men experience mild symptoms, while others experience significant urinary problems. Symptoms of an enlarged prostate. The symptoms of an enlarged prostate are mainly related to urination. This happens because the enlarged prostate presses on the urethra and affects bladder function. Common symptoms include frequent urination. Men may need to urinate more often than usual. This is especially common at night, a condition called nocturia. Waking up multiple times during the night can disrupt sleep and cause fatigue. Weak urine stream. The urine flow may become slower and weaker. Difficulty starting urination. Some men must strain or wait before urine begins to flow. Incomplete bladder emptying. The bladder may still feel full even after urinating. Urgency. Sudden and strong urge to urinate. Dribbling after urination. Urine may continue to leak after finishing. These symptoms may start mild but worsen over time. How enlarged prostate affects the bladder. The bladder is a muscular organ responsible for storing urine. When the prostate blocks urine flow, the bladder must work harder. This causes the bladder muscle to thicken. At first, this helps push urine out, but over time, the bladder becomes weaker and less efficient. This leads to incomplete emptying, urine retention, increased urgency. In severe cases, urine may stop flowing completely. This is called acute urinary retention, and it is a medical emergency. Complications. If left untreated, enlarged prostate can cause serious complications. These include urinary retention, complete inability to urinate, bladder damage. The bladder becomes stretched and weakened. Bladder stones. Minerals accumulate and form stones. Urinary tract infections. Bacteria grow in trapped urine. Kidney damage. Back pressure from urine can damage the kidneys. Early treatment helps prevent these complications. Diagnosis. Doctors use several methods to diagnose enlarged prostate. Medical history. Doctors ask about symptoms and urinary habits. Physical exam. This may include a digital rectal exam to feel the prostate. Urine test. Checks for infection or blood. Blood test. Measures prostate-specific antigen or PSA. Ultrasound. Shows prostate size and bladder condition. Urine flow test. Measures urine strength. These tests help determine severity and treatment options. Treatment options. Treatment depends on symptom severity. Lifestyle changes. Reduce caffeine. Reduce alcohol. Exercise regularly. Maintain healthy weight. Medications. Alpha blockers relax prostate muscles. 5-alpha reductase inhibitors shrink the prostate. These medications improve urine flow. Surgery. In severe cases, surgery removes excess prostate tissue. This relieves pressure on the urethra. Surgery is very effective when medications do not help. Prevention and prostate health. While prostate enlargement cannot always be prevented, healthy habits help reduce risk. Exercise regularly. Maintain healthy weight. Eat fruits and vegetables. Stay hydrated. Avoid excessive alcohol. Get regular medical checkups. Early detection leads to better outcomes. Conclusion. The prostate may be small, but its impact on health is significant. Enlargement is common, especially with aging. Understanding the symptoms allows early treatment. If you found this video helpful, subscribe to Anatomy of Life for more videos explaining the human body in a simple and clear way. Your health begins with understanding. Thank you for watching Anatomy of Life. Please don't forget to like, subscribe, and share.